Hi guys, what's good? What's popping? What's happening? You guys can see that I'm looking different on today's show. I have my shades on, I have my steez on. And I'll tell you why, because I have a special guest, someone that is very, very dear to my heart. And I'll tell you guys something later on in the show. I had to beg her and drag her all the way from, I won't tell you guys where she's from, but I made a lot of effort to bring this person on the show today. And I wore these shades, so I'll do that thing that macaroni does when I tell you guys what I want to speak about. But yes, so today on Yada Culture, we're going to be speaking about Trump and his decisions that he made. And those decisions, they involve certain points that I would want this person on today's show to speak about. So like when she says that thing, I'll now, remove my glasses. But yes, so on the show today, I have Doctor Tosin. Let me allow her to introduce herself to you guys. So, Doctor Tosin, thank you for coming.
Thank you for having me. Hello, everyone.
Mm-hmm.
Okay, I'm Dr. Tosin, and thank you for having me on this show.
Thank you for coming.
Yeah.
Thank you for shape awkward. You don't collect fuel from your hand.
No.
Basically, what that means, guys, is I don't know the English meaning, so we'll go back to that. So, I had a phone call with you, and I spoke to you about, or we're speaking rather about this whole Trump coming in as the president, as the newly elected president of the United States, and putting a stop to the HIV. What's it called now? Defunding. PEPFAR. Thank you guys. This is why I need to have a professional. So I want you to please shed more light on this subject for us, so that the viewers would understand that. Or first, let me start soft. I know you're not American. Oh, are you get?
I'm black.
You
Proud.
Okay. I'm not proud to be Nigerian, sure. But if you are proud, it's fine. I'm proud, guys. I'm proud, so that they don't come and arrest me. So yes, what do you think about the election and how Trump was elected as the president of the United States? Like, in your own little opinion, what do you think about it?
Okay, so for me, I think it was his time.
Well,
I think so.
Okay.
I think so. Despite all the challenges, and when I say challenges, what do I mean? All the court cases, the attempted, attempted murder around him and all that, and he still won the election.
Mm.
So I think it was really his time to come back.
He came out as a champion.
Yes, he came out as a champion. So
Well,
congrats to him, and I think yes, it was his time.
Okay, thank you for that. But yes, for the most important part of today's show, because I really want us to educate ourselves. I want to be educated as well, because I'm not really informed. And then I feel like a lot of people are also not informed about this whole PEPFAR thing. So, what is going to happen to people that are doing coitus? And what is going to happen with the HIV funding that has gone away? So this is the part where I remove my glasses, but it's like it's not key. So let me just remove it all. I hope it keys like that. So what do you think about it? What is the way forward, really? And I think I did hear, I think some days back that Nigeria were among the 50 countries that were added to the list of countries that will be funded. But I want you to speak to us about people living with HIV in Nigeria, how the treatment is, how this funding has helped, and the dire effects that it would have on the people that are living on this funding, if this funding stops coming in from Nigeria, because I know it's a lot of money. So.
Okay, so currently in Nigeria now, we have about 2 million people living with HIV. from young people to adults and all that.
Over 2 million.
Yes, over 2
Sorry to
million
cut. How
people.
many are you in this Nigeria?
We are a lot.
Uh,
So over 2 million people are currently living with HIV, and they get their drugs for free.
for free.
Yeah, they get their drugs for free thanks to international donor. And the major one is actually the PEPFAR. PEPFAR means the US President Emergency Plan for AIDS relief. So they give to support HIV treatment, support prevention measures, intervention, recruitment of health workers. So they do a lot with that money. But for the people living with HIV, they get their drugs for free. Although Nigeria contributes maybe about 20%, but most of the fund for HIV treatment, prevention, and all the activities around HIV actually come from international funding, the PEPFAR and some fundings here and there. So, and HIV people living with HIV rather, they get their drugs for free. They do a lot of things and they get those things for free.
I didn't know that.
Yeah, they get their drugs for free. We give condoms out for free. So a lot of things are being done for free, counseling and all of that. So the fund has really helped. And with the fund, we are able to work on trying to control HIV, try to reduce the burden of HIV in Nigeria, because Nigeria is one of the top countries with the high burden of HIV all over the world. I think we are fourth.
My God.
All over the world, yes.
Nigeria,
so it's a lot.
It's number 4.
Yes, Nigeria is number 4, if I'm right.
We're good in this country, right?
Yeah.
They try.
Okay, if you say that,
we always top.
Top for not so good things, but okay, no problem. So the funding has really, really helped. So Trump stopping the fund was like a blow, not even a blow, more like he just came to choke us. Choke us. Because if that funding is out, so how do we sustain all the activities around HIV AIDS?
What do you think will happen? What's going to happen to the people living with HIV and AIDS? What's going to happen to them if that funding doesn't come?
So if the funding is not there, it means we won't have drugs to give them for free.
So they then have to pay for this drug?
Yes, they may have to pay, except the government decides to not really give so much into health. And I think they've already drawn the budget for 2025. And if I'm right, the funding for health, according to the Nigerian budget, is not even up to 10% of the total thing. So I really don't know where we'll get that fund to support HIV treatment. So cutting off that funding, really what would have happened is this: people will not be able to get their drugs. And if people don't get their drugs, what does it mean? It means they continue to live with the HIV. They can spread it to other people. It means the HIV will spread more. All the preventive measures we are taking, we will stop it. It means HIV will spread far and wide all over the country. So it is not just, people won't get their drug. No, it's the ripple effect afterwards. So if people don't get their drug, what does it do for people living with HIV? It suppresses the virus inside of them. It suppresses it to a point that they cannot transmit it to someone else. But if they don't get their drugs, it means the virus can have a good time in their body and they can transmit it to other people. So it's not just about them not just getting their drug. Now we are thinking, this thing will continue to spread. And all the measures we are taking, all the counseling, all the different health education, going around the country, you won't have all of that. And the virus will continue to spread and it can just become another big problem.
Sorry to interject here, Dr. Tosin. So I just want to understand. We're talking about how expensive the treatment and the conservation of people living with HIV and AIDS. I just want to ask, what do you have an idea of the average cost of the HIV drug? Because I'm just, because we keep saying that funding, things will happen, but is it affordable for an average Nigerian to be able to get, living with HIV, to buy this drug?
Okay, so it's over about 20 years now that we've had support. So we've always had drug for this HIV. So right now I really don't know how much it costs, but I'm sure it will be expensive to buy that drug. And because you take it forever. So it is not just maybe it was a drug you just take for 3 months.
So
And
it's a
okay,
drug you take
you
every
take
day
every
of
day.
your life.
You take every day of your life.
Wow.
So it's a drug they take for life if you want to live healthy. So I really don't know the amount it will cost, but I'm sure it will be pretty expensive for a lot of Nigerians. Currently looking at our economic situation, right now, people are trying to get food, are trying to get a lot of things that they cannot even afford. So it will be pretty expensive for them to buy every time. And the good thing about it, when they give them the drug, they give for about 3 months. So you get your drug, you go for about 3 months, and you are fine. So even if some people may be able to afford it, but how long can they sustain buying the drug? So it was really a big blow. And if you are not taking the drug, you get sick over time. So that is it.
Man, I mean, like I said in the beginning of this episode, I wasn't informed as well that. I feel like I wasn't even informed until some weeks ago that the US. I didn't know about the initiative because I think it started sometime 2000 and early 2000,
Yes.
2001,
2005.
From I think it was
Yes.
President. I think it was Bush or something. I don't know. That started the whole HIV funding thingy to nations, but I didn't know it was a real thing. Honestly, I just thought it was just and I also didn't know that HIV medicines are free in Nigeria.
It's actually free.
But if I do recall, I can recall that I've been to a particular research building in Lagos, and I saw a lot of people. And I asked someone, what are these guys doing here? And the person said, oh, they are yet to collect their meds. And in my head, I just thought, meds for HIV, they already probably made a deposit or a payment somewhere. But yeah, that's why I have Doctor Tosin, guys, and she has been able to break it down for me, tell me how the whole HIV meds and the dire effects that it would cause if this funding stopped. And we're just happy that with the news you're hearing.
Yes, there's an emergency fund right now, a waiver.
But we don't know. Do you think
how long that will?
And if it will still be as the amount will still be as cumbersome as it used to be, do you think it would still weigh like the previous funds that were sent?
Right now, there is a waiver. So there is funding now, but we don't know how sustainable that will be. And like you said, we don't know if it will still be as much as what the PEPFAR was supplying. But I think it is just a wake-up call to Nigeria, to the Nigerian government, to start looking at funding. Yes, to start looking at funding it. Because yes, there is a waiver, but you don't know how long that will last for. Maybe for 1 year, 2 years.
Money as Nigerian citizens.
I know we are winning money. Whatever. But the Nigerian government, it's a wake-up call to the Nigerian government to look into health. Because on the long run, health affects the economy. That is it on the long run. You may think, health is just basic, there's really nothing there. But at the long run, it actually affects the economy. So the government needs to start looking into it because we don't know how long this waiver is going to last for. Yes. What if they wake up in 1 year, 2 years, and they say, finally, there is no fund, there is nothing. So before we get to that junction again, this is like a wake-up call, opening our ears. And the government really needs to look into it and start drafting out how to start funding. How to start funding, because we are all Nigerians. So Nigeria should take care of Nigerians. True.
Well, lastly, so that I allow Dr. Tosin to leave, because like I told you guys, I had to beg her to come today. So, Valentine is around the corner. And with this rate of the amount of people, I did not know, guys, that people with HIV are that much in this country. Valentine is coming, my people. You should, guard up if you want to guard up. Me, I'm not saying you should not, because I feel like I'm going to allow Dr. Tosin to talk now. I feel like she's going to tell you guys that people should abstain. But my own is if people want to abstain, fine. If people want to do, And if you want to do with, this thing, I don't want to talk. If we should go and get yourselves tested, right?
Yeah.
And if we should just know Jesus as your Lord and Savior. That's all I want to say to you. But Dr. Tosin, please, what do you have to say about my brothers and my sisters that are watching me that already have plans for Valentine Day that is, just around the corner?
Okay, now you said part of it. So
Okay.
you've made my job really, really easy here. So the truth is this. The first thing is know your status. So know your status, if you are positive or negative. So if you are negative, anything you want to do, there's this principle we use, but that is for there's this principle we use, but it's actually for sexually transmitted infection. Anyway, HIV is part of it, so let me just share that with us. There's something called ABC. So we say A is abstinence. A meaning you abstain from sex. Although HIV is not only transmitted through sex.
Sexual intercourse.
Yes, there are other ways through using of sharp objects, especially if it has been contaminated, through mother to child and all of that. But because of Valentine, and we know what we are talking about, so we say abstinence. If you don't have to do, don't do. Just stay your own day.
If you don't have to
however,
that means you can do.
However, the B says be faithful, meaning if you have a partner, so ensure your partner to get checked. So if both of you are negative and you are faithful to each other, so you say B is be faithful to a faithful partner. So you just have one partner that is probably negative, then you are safe. Then the third one, which is the C, is condom. So use of condom actually prevents HIV transmission. So that is it. So pick anyone from these three. And like I said, it is not only spread through that means alone. You have mother to child, whereby a woman is positive, she's pregnant, and she can transmit it to her baby during pregnancy, at birth, when feeding her baby through breast milk and all of that. So, but more importantly, you need to know your status. So you know where you are right now. And if you're negative, you want to remain negative.
Yes, please.
So you don't join the 2 million people because you are still trying to sustain the fund to take care of them.
Very, very
so
important.
that is very, very important. So that's what I will say about that.
I want to wear my glasses, guys. So I hope you guys have been able to learn a thing or two from my beautiful guest today. So let me tell you what I learned. ABC. 1. A. Abstain. B. Be faithful to a faithful partner. And C. Use the condom. So thank you for sticking around, guys. If you enjoyed our video, please make sure you like, you share, and please subscribe. Drop those comments. Let's hear what you think. And I'll see you guys next time.